to HYBIZ News. My name is Suresh Pochatan. Today we have with us a long-distance conversation with somebody who has been in the thick of the COVID-19 pandemic. I'm speaking about Dr. Amina Ather, a public health specialist with a PhD in it. She's also somebody who dabbles in gene therapy. Very passionate about her job, very passionate about the fact that the number of people who are dying across the world hurts her a lot. She was in the thick of the action. And Dr. Amina, welcome to the show.
Thank you so much, Suresh ji. Yes, it's a pleasure for me to get connected with you. And I still cannot forget those 4 hours trying to look for your contact back on Facebook from Bangkok.
Okay. So here is what will start. I will leave you to speak so that I will speak very less of it and I will allow you to speak more. So the point to start with is, do you recollect the early days of the COVID-19? Where were you? What were you doing? When did you trying to land up in China? Just take us through the entire journey, please.
Okay, the word COVID still doesn't fit into my brain. I always go back, when the child starts learning, the first words stay in the child's brain. So for me, whenever they say COVID, it doesn't register why they are calling COVID, something like that. So my journey started on 22nd of January when WHO declared something called a global emergency, which was an epidemic in China. At that time, it was a virus which is of corona origin, something like SARS or MERS, and it has originated from Wuhan, and there was a fight whether it is supposed to be called as Wuhan virus or China virus and everything like that. So for me still, it doesn't fit into my brain what is COVID and other things. And this COVID came only on 11th of March, only after it was declared as pandemic. Somewhere between 22nd of January to 11th of March, it was an epidemic. Then they said, okay, let us name it to the disease, which is caused by the coronavirus 2, the coronavirus version 1, which was already there. And this is 2 because it is different from that. And I think so as the coming days or coming years, what will happen, we will have a number of coronavirus 3, 4, 5, 6, 7, 8. But COVID will be the disease caused by disease caused by a virus which origins as a corona. So it was on 22nd of January when it was declared as a global emergency. I arrived back from Bangalore to Germany on 21st of January. That was late evening, and 22nd morning because I had time, and suddenly my WeChat started ringing. So I did not get a WeChat ring for a long time from my students who were in Urumqi, and suddenly I got the beep of the WeChat, and I was like, why is my WeChat ringing? And then I hear from my students from Urumqi that there is something which is like a chaos and nobody knows, the doors are locked, and they were in a panic, and it was just about 30 seconds. The call lasted only for 30 seconds and it was disconnected. So again, after an hour, and another student called me and said, we are supposed to surrender our phones and everything. There's some kind of a virus. And then I put on the news on BBC, and I was just, because I watched BBC, and I saw this as a global emergency, which was declared in China. And after a few minutes, I received a mail on my email saying that I'm supposed to come down to Urumqi, because I am an emeritus professor from People's Republic of China, and they want me to come down to Urumqi for clearing the project costing, which was given to me. Like I'm heading a certain amount in the university, and I have a lab in Urumqi where I established this lab in 2016, and I also visited Wuhan for a week, and it was like, for me, a few minutes were blank. I had no clue what was happening. Then 23rd, 24th, 25th, 26th, and 27th, I was only trying to figure out these 4 days, what actually was happening. And then each day was different. All of a sudden, we were not, because I hold an Indian passport, and Germany stopped the visas to China. Then I was like, okay, now I need a visa to enter because I still hold an Indian passport. And I don't have a German passport, so it would have been like I just fly. They said that, okay, you can just fly to Gozong and we take you inside China because we are calling you. They gave me an invitation letter, but I did not want to take a risk. You fly from Germany, you are landing in Gozong, and you don't know what is going to happen with you, right? You don't know, you go to the airport even here to Bremen, or to Frankfurt, and even in the airport. So I said, no, I want to have a valid visa. So I will go back to India with the invitation letter and I'll apply for a visa. 29th of January, I came down to Bangalore. And as I arrived in Bangalore, the next day it was closed. Bangalore closed for the visa.
You landed in Bangkok and then you proceed further to China. So take us through that journey of yours.
Okay, take me to the journey of the Bangkok. So obviously I had to get the visa, and it was only Thailand giving the visas at that time. So there was no country issuing the visa to China except Thailand. I landed in Bangkok, and I went down to the hospital where they claimed on 2nd of February, they claimed that they have found a treatment for COVID-19. So coronavirus 19, because I think you heard it, they were the first ones to claim that they found a treatment, right? Anti-HIV drugs and the other drugs. So when I went there, and when I started discussing with the doctors, it was not falling into place like what I had thought. And then I tried to call you and say, okay, look, something is not right and I don't know what's going to happen. Probably I may not go further to China because it's a total confusion. One is I was not able to connect to any of my students back in China. My WeChat was not working. The calls I was giving, they were not replying. It was like a blank. I was like in a vacuum situation. So after that, I went down to the airport, and for my belief, there was not a single flight going to China except the smaller flight, which was for us, who were supposed to go to China on this. And at that time, I was for 8 hours at the Bangkok airport, where I did not realize what to do. And obviously, I also called you. I had a lot of herbs. I had a lot of things. I had a medical device and a lot of things, and which I was taking in as an emergency services to China. It was not for marketing. I mean, I was taking it as my personal device, which I have used.
What was this kit which you're carrying? What can you just describe it to us? What was the kit you're carrying?
Whatever the things I was carrying. Okay, I was carrying about 18 herbs, which are phytomedicine into the capsules, and 2 to 4 kilos of dried ginger and turmeric. Like I told you that when you get into China, you need something for yourself. So I was only carrying the spices, the food, and the other things in the bag. Apart from that, Dr. Jaziri from Dubai, he had given me a small hyper-ion plasma box. He had given me a small box. It generates the negative ions. That's what you are hearing. The Pune Institute is bringing up the air ions and everything. So I was carrying this for my personal use because I had to prevent myself, because I'm going in there, I don't understand. And I had been working on electromagnetic resonance projects in China, in Urumqi, but I don't know what I'm going to do. So I was carrying this as a personal device, and my whole bag of 30 kilos was with all these things. It was for me and my students. I mean, it nearly costed around, including probably the device in the market or what. He made a personal device. He made only a generator for me, Dr. Jaziri, which I use it personally. And then at this stage, of course, I had something which is unique, right? And I had something which is, I mean, what do you say, phytomedicine, eucalyptus oil capsules and other things. The bag itself costed around 25 lakhs. And actually, that was a time I said, see, maybe this is going to be a disaster. Maybe I thought you were in Bangkok and I can leave that back with you rather than getting it back to Bangalore. Maybe somebody needs it there. It was not to make money or business, but you will not get those things back again. Now you see, I want to transport one device to my own house and I can't do it. I can't do it. Even I can't get 100 grams of turmeric, which is purest form, into a capsule right now. Neither from Delhi to Bangalore, Bangalore to Delhi. So imagine at that time, I oversaw somewhere that, okay, this is needed for the people in, I mean, somebody whom I know, that because I could again get it back in Bangalore, right? And it happened like I was for 8 hours in Bangkok airport. And yes, I'm just sharing this now because I think I have to share this now after keeping my silence for almost months. Student's father of me, he came down and he was supposed to travel with me. So he is having his business in Gaozong and China. His daughter was studying in Urumqi, his child, or daughter or son, I don't want to mention who it is. Then he said, he told me, ma'am, I just told him, I don't know what to do because I really want to help the kids. I want to be there. But if I go, I have to put my fingerprints, I have to put my eye scan, I have to do everything in the university. So my only fear was not death, not COVID. My only fear was my family members, my anybody related to me would not find any trace of me after I enter China. That was my worry at that moment. See, if I was to be dead, I had no worry. If I was to be arrested or whatever it is, I had no worry. I had no worry even getting contaminated with COVID. When I even started to travel from Bangalore, my mother had tears. People are dying. It's such a deadly thing, and you want to go. I said, I don't think so. I'm not afraid of this. I have PPE. I mean, my first instruction, what are the things I want? Was I wanted a transmission electron microscope. I want PPE. I want gloves. I want mask. I can even show you the list. But my only worry was the people who are connected to me, like how we were worried when we were not getting connected to the students. Like I saw the father of my student, he was like helpless. We were helpless because we couldn't connect. Then I gave the whole bag to him and I said, just take it with you and bring back the children. I just said, take this bag with you and bring back the children. And even now he says that we have to give you back. Aapka kharaj hamare upar ho gaya. So what happened? This bag went down and it was in the makeshift hospital. 18 of my students got well, and this bag helped 3,000 people. I am not taking any claims of this. Even I can have tears. I never knew that bag, which I wanted to leave in Thailand, helped 3,000 people to survive. I have no clue about this. I have no clue about this. And yes.
The next question, the most obvious question would be, in terms of where you landed up after coming back from Bangkok. You realized that you couldn't proceed to China. You had to come back. So where were you after that? What happened?
I was in Bangalore, and I met Mrs. Gangambika. She is a former mayor of Bangalore. Then I explained to her, like, this is this. And there's also one personal device with me in Bangalore. And I can donate it to Rajiv Gandhi chest diseases. And I had my colleague, Dr. Nayak, with me. And I went myself to the Rajiv Gandhi chest diseases. First day, he said, okay, come down tomorrow. There is a virology department. There are 3 cases in India. And yes, of course, I knew the 3 cases personally. They had already approached me. And I requested myself that I'm going to put up this personal device in Rajiv Gandhi chest diseases, and I want to make this room, which would be something different. And yeah, so they wouldn't confirm that India will get this virus. Yeah, we have immunity, we have this, and believe me, 3 hours from 11:15 to 3:45, we were there. I was there. From 12:45 to 3:15, I was sitting outside just where the chairs for the waiting is there in the director's office. And he says, we have to get the permission from the center, we have to get the permission from SAID. And I had my flight in the evening to Germany. I called up, I don't want to mention this person, I called up this person, and I'm really thankful to this person. And he said, Amina ji, ye log aapki baat nahi samjhenge, aap Germany chali jaiye. जब जर्मनी में आप करेंगी, जब वापस आएंगी, when you have this media reports and other things, your intention is to help, so don't think about it. Then what happened? We got a sample of a blood sample of a viral origin. We did a study with the device, and after that, I gave the device to a couple of my students, whoever were there in India, and they have used it, and it's come out very, very well. It's been helping them. And so that's happened. And again, I had the night I traveled back to Germany. So I was back in Germany on 5th of February. And 4 days, I got the reports of this viral load, what we did. And with this viral load reports, I asked Dr. Jaziri, Dr. Jaziri, this is this. He said, okay, come to Dubai. We have about 7 or 11 cases. Let us do it here. Let us do your whole concept. So the box, the Pandora box.
Germany was just then getting into first few cases. I remember you went into
It was not there for February 1st and 2nd week. Hardly there were 2 or 3 cases. And okay. Dubai had 10. Dubai had 10 at that time, and it was in Rashid Hospital. And my Pandora box of the herbs and the eucalyptus oil, and I just went, and even this is crazy. All the flights I booked just 3 hours or 4 hours before the departure, before the check-in. So I just took a flight to Dubai, and I landed up there again with a bag, of herbs and, vitamin C and the eucalyptus oil and other things. And I was in Dubai, where we also communicated with COVID, and then we also helped them to get themselves recovered and other things. And from there, it was on 27th of February, I came back to Dubai. I came back to Germany from Dubai, because that time, so it was so stressful for me. Just I wrote to one of my colleagues, like, yes, and they were all panicked because when you arrive in Germany, you're supposed to report. I was like, I just wrote, I'm in touch. In touch means I'm touching. So obviously, if it is like that, you're supposed to be quarantined. I couldn't understand how the reaction was. When I came to Germany, I was like, what is happening? I went straight from the airport to my house from 29th of February to almost the end of March, April. Now it's May, right? I was only in the house. It was not 14 days quarantine, it was 40 days quarantine. I did not come out of the house. My colleagues have been very, very good. They brought the grocery to me. They managed everything in Germany. I did not even move out because I was not sure, like when I'm traveling, what has happened and how it is. So that was this thing. And all these days, I managed to communicate to my students in Shanghai, China. Urumqi was the biggest base, and Shanghai and Gozong and Qingdao and also Dubai, where all the network is, maybe around 4,000 to 5,000 positive cases of COVID. They call me every day, and all these 2 months I have been busy guiding them on Zoom and Microsoft, training the doctors, especially Turkey. Turkey has been very close to my heart. They put me immediately to the head of the hospital in charge, where they are the doctors, where they made a 10,000 bedded makeshift hospital, the big ones. I to talk to them and give them the guidance how to handle the situation. Maybe something like putting the doctors also in the forefront. And then I spoke to you on 20th of March. I said, Sureshji, the actual contamination begins now. We have to be wary of that now.
I remember the conversation. So, which is why you want to ask you, Dr. Amina, you were a bit worried then. You're not bit, I think you're a lot worried then about how this entire thing would pan out in India. I know your heart rests in India. So even though you were in Germany, you were worried about how India would take this entire virus that was coming up and how we should handle it. Do we have the capacity? And I know you had a lot of doubts in your mind. But if I ask you, how did India handle it?
I still can't say anything. How did India handle it? India were lucky enough because they saw something going on. It's just like the first few students go for a YOVC exam and the last one knows what are the questions being asked. He knows at least the course of it. So India knew the course of the whole situation. That's why I said, Sureshji, I'm not going to start my blog. I'm waiting for for some more days. So I told you Mumbai would be the epicenter because always my worry was most of the flights coming down to Europe, coming down from Europe were in Mumbai. So my biggest worry was Mumbai to be the epicenter. Yes, a couple of days back, 2 days back, we got to know, yes, Mumbai is epicenter. India has handled pretty well. I think Indians, to say, like you, like many others, they have really come forward in the situation. One was a lockdown and strict lockdown. Hats off to those police guys, bringing the people back. And somehow we have arrogancy and ignorancy in India because the media has the freedom, and more than that, people have the freedom of speech in India. And the one thing, like, everything spreads. The minute what we are talking also, you will see somebody circulating the same video within half an hour and you don't even know that person, right? And the way the things have been taken up in India, the government has done marvelously well. It's done exceptionally excellently well, by putting the people into the closed doors, trying to track the people, getting the applications, being on the media, coming up with a briefing. See, when you compare India and Germany, like I live in Germany and India is it, and Germany is just 10% of the population of India.
Okay.
It's just like you have a house, you have 10 children, and you have a house, you have one child. It's easy to control one child, but for 10 children to control, everybody is having. In this way, India has really been faring very well.
So question to you, Dr. Amina ji, before I let you go, is that do we learn to live with Corona? Because that seems to be the latest one. We're waiting for Prime Minister Modi to come on at 8 tonight and speak to us. and address the nation. And the expectation is that, of course, he's going to announce a big economic stimulus package. But more than that, just like the earlier version of SARS that we had, are we
Yeah.
going to live with this virus?
Of course, we have to live with this virus. ये तो क़यामत तक रहेगा. I'm not saying 1 year, 2 years or something. I'm saying the word directly क़यामत तक. We know that we have to live with this virus. See, it is like एक शैतानी बच्चा घर में है, उसके साथ रहना ही है. But you only need to know कि उस शैतानी बच्चे को कैसे ढेलना है. How are you going to deal with a naughty kid at home? So this is a naughty kind of a virus which is going to be in all our life. One time or the other, you, me, everybody will be infected, just like we all got typhoid once. It will be there.
Yeah, there was all this talk of herd immunity. Is it really something called herd immunity?
Survival of the fittest.
Okay.
Survival
I think it's a good
kind of.
Yes, Dr. Thank you.
I don't call it as herd immunity. I don't call it as anything. I just call it as survival of fittest. That's it.
Thank you very much for speaking to us at HYBIZ TV. It's been a pleasure interacting with you. I know it's early day in Germany now for you, and thank you for coming across and speaking to us at HYBIZ TV. Thank you very much.
Thank you so much. Thank you so much, Suresh. Take care and wait for your PMO for the good announcements. I hope we don't have anything extra to be done.
Thanks a lot. Thank you. Bye-bye.
Bye-bye.